Hi everyone, this is Neel Raithatha, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the iCLEARscope endoscope. It is a pretty short video. I've had a really busy day today. We've had another ClearWax training course. We trained another 3 specialists in the UK, 1 using the iCLEARscope endoscope and 2 specialists using the WaxScope, and it went really well. They all did fantastically well. I've got another training course tomorrow, so I'm just preparing for tomorrow. And I just thought I'd upload this very quick video. So for a patient who attended with bilateral occluding soft dark wax, I've just put some medical grade olive oil spray in there just to help soften and coagulate the wax. It's a bit of skin there, you can see it just has come away. And the wax is compressed right up against the canal walls. This is where the oil really helps. Not only does it change the consistency slightly of the wax to make it a bit firmer and bind it together, but it helps to lubricate the canal walls to facilitate this outwards movement, this extraction, as you can just see. And with soft wax, it has a tendency of blocking the inside of the suction tube. So the oil helps to lubricate the suction tip inside, and that helps the wax to move along as it's getting vacuumed. There's a dark plug there. Nice healthy eardrum, quite a large ear canal actually, very circular. Most ear canals are oval shaped, so the height is greater than the width. This is very cylindrical, so the height is more or less equal to the width. Bit of a tympanosclerotic patch. Well, I'm going to rephrase that. It's a maryngulosclerotic, so there's a bit of scar tissue there. The bottom right side of the eardrum is very small, so if you can have a quick look back, there's a little white patch. So I think the patient did suffer from childhood ear infection, so that might have been the underlying cause of that scar tissue. So this is their left ear. They didn't actually feel this ear was blocked until I removed the wax from their right ear. It's only once I cleared the right ear that they perceived their left ear to also be blocked. And that's quite common. Patients often attend believing just one ear to be blocked, the worst ear, and that they're contralateral, so the opposite ear is absolutely fine, and it's only when you clean the bad ear, the worst ear, that they then realise what they perceive to be their good ear is actually their better ear, and there's also a bit of a hearing loss there. So similarly, I'm just going to put some oil in that if I haven't already. This one's a bit more mushy, it's a bit more dead skin. So that there, that rocking motion, what did the patient do? I think he was laughing. He said, we were chatting and he found something I said funny, so he started laughing. So I obviously came out the ear, and I should know better. I shouldn't have said, I don't know, it was a joke, and obviously we want our patients to remain nice and still. Having said that, we've always got a good brace, even if a patient does move suddenly. The way I hold the endoscope and also the suction tip now with my new Rise suction tips, which enables me to have a really solid brace, because it's a shorter handle, meaning my holding hand is closer to the patient's head, whereas the common suction tips in the UK, the handle is a lot longer and the grips on the handle is further down on the handle itself, so it's harder to get a brace. So I'm just going to roll this out. It's just coming out in a plug, so it's been there for a while, it's oxidized. It's a regular patient, perennial wax removal. Bit of staining there, but that's fine. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.